My name is Thandar. I'm a pharmacist, clinical pharmacologist and lecturer at the Durban University of Technology in South Africa. I'm the principal investigator and main author of this paper, which is a systematic review of topical herbal extracts for atopic eczema. The systematic review was done in collaboration with my co-authors from the Nelson Mandela School of Medicine and the University of KwaZulu-Natal, both in South Africa. We did this study because atopic eczema, being a chronic debilitating condition, affects the quality of life of many of the patients who suffer from the disease. Many of these patients or the parents of the children who suffer from this disease are constantly exploring complementary and alternative medicines, desperately in search of a quick fix, despite the availability of medicines with proven efficacy that are widely available to dermatologists. Also, these patients or the parents of these children are concerned about the long-term side effects of topical steroids and are thus constantly seeking for something which they consider to be more safer and more natural. The best way to attain clarity on the efficacy and safety of these complementary and alternative remedies and to assist clinicians in advising patients was to conduct a systematic review. Despite numerous clinical trials that have been published with regards to topical herbal remedies for atopic eczema, we found no conclusive evidence regarding their role in the management of atopic eczema, and this is what spurred our work in order to answer this question. Our systematic review followed the Cochrane methodology. We searched numerous databases up to June 2014 and used varying search terms, and we initially retrieved 3,813 studies. We included all clinical trials of topical herbal medicines that were conducted in human patients for atopic eczema and that were published in English. 8 publications were finally selected. All the included trials were randomized controlled trials conducted between 1990 and 2011. We extracted the essential data from each of these studies, and each reviewer independently conducted a risk of bias assessment according to the Cochrane domain-based evaluation. 7 of these 8 studies were conducted using extracts of single plants, and 1 was an extract from multiple plants. Of 6 studies that claimed that their investigational agent was superior to placebo, only 2 had a low risk of bias across all domains. These were the trials with the licorice gel and Hypericum porphyratum. Even though there were variations in diagnostic criteria and a lack of validated tools of assessment in one of these studies, the results from these 2 studies were promising and warrant continued research in studies with improved design. With regards to the relevance of our study to prescribers and patients, we find that as many patients are using complementary medicines, mostly together with their conventional medicines, impacts on the course of the disease and the treatment prescribed by their dermatologists are always possible. We feel that dermatologists need to be much more knowledgeable about the evidence or lack of evidence of these complementary medicines and their safe use in order to be able to advise their patients accordingly. Our study provides clarity to prescribers and patients about the current lack of evidence of efficacy and safety with topical herbal extracts for atopic eczema, and it identifies opportunities for future research in this field.